I am Marjurie, Ando, your student nurse for today. So for today, I'm going to perform the Leopold's maneuver. It is a method of palpating the abdomen wherein the fetal presentation, light, and position are determined. Used to estimate fetal size, locate fetal parts, and determine presentation, position, engagement, and attitude. Also to check the fetal heartbeat. So first, I'm going to explain the procedure to the patient. This helps elicit cooperation. Hi, Mom. I am Marjorie A. Ando, your student nurse for today. May I know your name and birthday?
Krishna Marie Vidya, June 16, 2000.
Okay, so today I'm going to perform the Leopold's maneuver, which is a method of palpating the abdomen wherein the fetal presentation, light and position, and determine used to estimate fetal size, locate fetal parts, and determine presentation, position, engagement, and attitude. Also to check your fetal heartbeat. So the second is perform medical hand washing to prevent transmission of microorganisms. So I'm done performing hand hygiene using soap and water. I'm going to perform a hand hygiene using an alcohol. Also, don't forget to have a patient privacy. Next, assist the patient to assume supine position with her knees slightly flexed, dorsal recumbent. This relaxes abdominal muscle. Okay. Next is ask mother empty your bladder to prevent uncomfortable feeling. Uterus is easier to palpate in an empty bladder. Okay, mom, so before we begin, I encourage you to avoid first so that later you won't feel uncomfortable, okay? Okay. Mom, can I have consent to uncover your tummy? Okay. Next is take the fundal height starting from the fundus of uterus to the symphysis pubis using a tape measure or use the finger breadths as pins with the umbilicus and sipod process to the landmark to determine the height of the fundus, AOG, and fetal size. Next is warm both hands by the rubbing palms against each other and use palms, not finger. Because cold hands cause abdominal muscles to contract and using fingertips to palpate will tickle the patient. So let's proceed to perform Leopold's number 1. Facing the patient, palpate and determine what parts of the fetus is located on the upper part of the uterus, fundus using the entire surface of the fingers of both hands. Okay. It is a hard, ballotable mass at the fundus means the presentation is cephalic. So next, proceed to Leopold's number 2. Still facing the patient, transfer both hands to the side of the abdomen, palpate and determine the parts located in the right and left side of the uterus. Apply pressure at one side while palpating the opposite side. Repeat this action on the other side. Confirm your findings by locating and listening to the fetal heartbeat using the stethoscope or the Doppler. Okay. Is to determine location of the fetal back and small fetal parts and fetal heart bone. Next is to perform Leopold's number 3 facing the patient's head. Bart grabs gently the lower portion of the abdomen which is just above the symphysis pubis using the thumb and the fingers of one hand to know its presenting part and how far it has descended. Is to determine if the presenting part is floating or engaged. And next is to perform the Leopold's number 4, facing the foot part of the patient. Place fingers on both sides of the uterus about the inguinal ligaments, press downward and inward. To determine the fetal attitude. Okay, ma'am, so now we're done with the procedure. I'm going to cover up now. So, are you comfortable? So after doing the procedure, I have determined that your baby is at your right side and that your baby is in cephalic position, which means the head of the baby is at the lower part of your uterus and it is now already engaged. This is an ideal position of the baby for labor. Okay, mom, thank you for your cooperation to my entire assessment. So that's all for today. God bless.